Welcome to Health
Health
Beats. It's Hanan and Katie here.
Yeah.
We're back.
Season 1, episode 8.
Woo woo. And we have another really special guest that we cannot wait to speak to today and share with you all one of her really great healing modalities. So, introducing Dr. Whitney Dunlap, who is an acupuncturist and, might I say, quite a few other modalities that she has under her tool belt too. So, hello, Whitney. How are you?
Hi, I'm good. Thank you. Thanks for having me. I'm excited to be here.
Well, thanks for being with us today. We're excited to have you too.
Yes, it's our pleasure. So let's just dive right into it. Tell us about your background. So you have studied quite extensively under acupuncture, correct?
Yeah, so I originally went to school for chiropractic. And as I was in school for chiropractic, decided that acupuncture would be a good modality to add to my tool belt. So I got certified in acupuncture and then went on to also become a naturopathic physician as well. So
wow. Okay, so you are a woman of all trades.
Try.
So tell us, what kind of sparked your interest into acupuncture in particular?
Yeah, so when I was in chiropractic college, I actually was going through infertility. So for during the time, I think it had been 3 or 4 years, my husband and I had tried to have a baby and we were not successful. So we went to doctors, and a lot of medicine pushing was kind of what we were told, and then surgery was the next bet. So we decided to try acupuncture as a form of infertility treatment. So that's kind of how I got introduced to acupuncture, loved the benefits of it, and was something that I knew would benefit my patients as a chiropractor.
Wow. That's a very personal connection to acupuncture.
Yeah.
And then you had a baby too, right?
Yeah, I did have a baby. A mixture of acupuncture. Thank you. Yeah, a mixture of acupuncture and herbs. Herbal medicine was kind of what helped us in our infertility journey.
And so then that's kind of what opened the door for naturopathy for you, correct, as well?
Yeah, exactly. Kind of more focused on that herbal medicine and how that as well is very important in people's healing journey.
Yeah, 100%.
Wow. What an inspiration.
Yeah, thank you for sharing that with us. So for our audience who might be new to the idea of acupuncture, we hear about it, but there might be some questions surrounding as to what is it really? What can a patient expect when they go in for an acupuncture session? Maybe what reasons, why would they go in there? What could they expect during and after? Kind of walk us through that journey if you can paint the picture. I know that's kind of a broad question because I'm sure you get so many different backgrounds of patients, but kind of just on a basic level, how would you describe that?
Yeah, so it's a good question. And a lot of people get a little nervous with acupuncture because they just relate acupuncture with needles, and needles can be kind of scary. But acupuncture, we just use very small steel needles that are placed along certain points of the body, what Chinese medicine calls channels or meridians. And they're strategically placed to be able to help reduce symptoms or to help with certain conditions. And there's the reasoning behind it. I like to explain it in Western medicine, what we understand here in the United States, and then Chinese medicine theory. Okay. So Western medicine, the theory behind Western, how acupuncture works is, one, it stimulates the sensory nerves in the skin, which affects our nervous system and kind of tells our brain what to do. Two, it brings blood flow to the area, which promotes healing, brings nutrients, oxygen to that area, and helps heal the area that blood is going to. And then three, it releases endorphins, which are our body's natural painkiller. So that in Western terms is how acupuncture can help. In Chinese medicine terms, it's more about balance. We want to balance I'm sure you're all familiar with the yin and yang, the black and white like symbol. And that's actually really important. So it's restoring that balance of yin and yang, which are like opposing forces, which can block qi or like that life force energy. And so acupuncture is about bringing balance between the yin and yang so that the body, because it's such a powerful thing, can do its own thing in its own healing process.
So what it comes down to in Chinese terms is that if something is off balance within the body, then everything else is affected as a result.
Exactly.
Wow.
Yeah.
That sounds like yoga as an example, where you're trying to balance the chakras. Do people who do acupuncture, do they supplement it with something else?
So there's a lot of other things that are with acupuncture, right? So you have like acupuncture with needles. You can add electroacupuncture, which is like it's kind of like a TENS unit. Like you have like the stim units that help to contract your muscles. You've just placed these little things on the needles and it actually brings like electrical pulses through them.
Wow.
So that's one thing that helps to like stimulate. They use another thing called moxibustion, which is like burning of, I think it's mugwort leaves. And that is along the line. So that helps stimulate healing as well. You can use it with like cupping, which is another modality that is along the lines of acupuncture and like Chinese medicine. And then obviously they do herbs and are really focused on like eating different foods. So you've got your like cool foods and your warm foods, and they also do that, have that balance with the food that you're eating as well.
Oh, interesting.
Very interesting. And that kind of touches upon overall holistic healing, right? That even though you're utilizing those modalities and they can definitely help in the healing process, but it's really a whole lifestyle, right? If you only just put the responsibility on acupuncture to fix or heal some of your problems, well, you've already taken your responsibility out of it, right? You have to be eating the right foods. You have to be drinking the right amount of liquids and exercising. It's an overall holistic approach when it comes to healing. And I'm sure that's what makes the benefits of acupuncture that much more enhanced.
Yeah, 100%. So yeah, we can use acupuncture, which will help address the issue, right? But if we don't change the environment of which we are in, then our body will continue to go back to those dysfunctional way our body is functioning. Yeah, so we have to change that environment, and then acupuncture on top of that is just an added tool to be able to get our body to healing.
Makes total sense. So question for you, when you have these needles in the body, is there any certain areas that's kind of like hands off, or can you put the needles like anywhere on the body depending on what that patient is in need of?
Yeah, so as long as they're like within the channels or meridians, so there's certain points. So when I talk about channels or meridians, they are divided into different like organ systems. So you've got like the spleen channel, you've got the liver channel, you got the lung channel, the heart channel. And so as long as they're along those channels, and some of those channels go into areas that, might be a little scary for people close to the eye, but you would just acupuncture, you just put those needles in a certain way to prevent like anything from like damaging anything. And a lot of times, sometimes if you're not comfortable with those positions, you can do things like I mentioned before, like moxibustion or just like acupressure to those areas like that. But yeah, for the most part, needles can be placed anywhere. They're very small, so they don't go very deep into the skin. So it's very safe.
For somebody that's first doing it, is there any sort of pain that you would say to just to beware of, because these are needles going into the body, especially for those folks who might have a phobia of needles and shots, like my dad, for example. Sorry, Dad, but he faints. Even if he sees a needle, he will faint, even if it's on a movie screen. So I'm sure there's quite a few people out there. So how do you kind of go about that?
Very, very good question. It's probably the number one question I get when I do acupuncture. So, yeah. So mostly acupuncture is pretty relatively painless. There are certain areas on the body that you can imagine are a little more sensitive than others, but we actually use techniques like some certain breathing techniques that can help diminish pain. I usually let a patient know beforehand, hey, this area is a little more sensitive. You might feel pain, a little more pain in this area. And then we'll do a breathing technique. And most of the time they're like, that wasn't even that bad. So yeah, that's one way like I help prepare patients. When it comes to the needles that I use, there's other different needles, but I actually use needles that come in like a plastic tube. So the patient really can't even see the needle itself because you place the tube on the area that you want to put in the needle, and then you just like tap in the needle. So the patient generally won't even ever see the needle.
I'm sure that's
yeah.
very helpful.
Yeah, very much
kind
so.
of the
Yeah.
out of sight, out of mind mentality.
Exactly. Yeah. Yeah. And I've had patients that are terrified of needles, similar to your father, and they're like, oh, that wasn't even that bad, and it was just that initial scare, and then it's the benefit definitely outweighs any nerves or things that you might have.
Okay.
That's good to hear.
That's good. And that's good that you practice kind of relaxation methods for them so their body doesn't tense up and, psych themselves out even more.
Yeah, exactly.
So if somebody were to come into your practice and talk about what's going on for them, what are some scenarios that you would suggest acupuncture as a modality?
So that's a good question. So in all honesty, it's very, very hard. It would be hard pressed to find a condition that acupuncture wouldn't be beneficial. So acupuncture can be beneficial for many, many things. So back pain, neck pain, headaches, GI upsets, menstrual issues, infertility, like we had talked about previously. Yeah, it's really hard to find a condition that acupuncture wouldn't be beneficial. So people that have tried multiple medical modalities and nothing has really been working, I really strongly encourage people to try acupuncture and see if it helps. I've seen great success with acupuncture in practice, and so I think it's something that's beneficial for almost anyone.
Wow. What are your favorite success stories that you've seen?
So a couple that come to mind would be, we had a couple patients in with post-COVID like coughs. They had COVID a while ago and just had this lingering cough. Just like anything they tried wouldn't help. And both of these patients, 1 or 2 sessions of acupuncture and no longer had the cough. The cough was completely gone, and then had increased energy, had decreased congestion. All of that was just taken care of. So
wow.
And I want to emphasize that acupuncture is not meant to work in like 1 or 2 sessions, but I have noticed in practice that it really only takes 1 or 2 sessions and people have noticed a difference.
Wow. That's good to hear.
That's amazing. That's very inspiring.
About how many sessions do you recommend?
I generally say at least 10. Like give it at least 10 sessions, see how it goes. But again, most people see some form of benefit within the first 1 or 2 sessions.
Well, that's motivating for them.
Yeah.
That'll help them continue on to complete their treatment and see the full results.
Yeah, exactly.
Yeah.
And so when you say 10 sessions, is it like every week, or what is kind of the spacing in between each of those sessions?
Yeah, you can do it more than 1 time a week, especially at the beginning. If someone's like really acute, 1 or 2 times a week is really beneficial. All of these cases were just 1 time a week that I've had. So they just come in once a week and saw great results. Yeah.
How long is each session?
You just took the question out of my mouth.
Our minds are in sync.
Yeah, great minds think alike. Yeah, so if it's like an initial, obviously we kind of go through history and all of that, so that takes a little bit longer, but like a follow-up acupuncture appointment is really just like 10 to 15 minutes putting in the needles, and then you get to relax for 20 minutes. I always fall asleep knock out when I'm on acupuncture, and a lot of people do too, but 20 minutes of relaxation. Yeah.
Now, if that's not a selling point, I don't know what is. I think we all could use a good 20-minute cat nap.
Exactly.
For one.
Yeah.
Now, I know you mentioned about treating medical conditions.
Mm-hmm.
Have you treated any mental health conditions with acupuncture, and what have you treated?
Yeah, very, very good question. Yeah, that's probably one of the biggest things that we treat, a lot of stress and anxiety. And we've had people, like I've had a couple patients with really bad anxiety after with hypothyroidism, or just with the way the world is right now. We've had a couple people with just like high stress and anxiety. Again, within 2 or 3 sessions, anxiety goes from maybe like a 4 or 5 to like a 1 or 2, like really, really quick. Yeah.
You mentioned low thyroid, and it just made me think, are labs done, are other assessments done prior to treatment for the patient?
Yeah, definitely, especially in our practice, because I'm a chiropractor and naturopathic physician. That's really important to us here, to kind of get to the root cause of what's going on, and not just kind of like treating the symptoms. So yeah, we do like a full physical exam, and we'll do like lab testing, like if we think it's medically necessary, to kind of get to what's going on. So not only can we help treat with acupuncture, but also other, like we talked about earlier, lifestyle changes that need to be made.
Wow. So it's very integrative.
Yeah, very much so.
That's amazing.
Do you collaborate with other practitioners of different modalities? Like, is there a team that you work with?
So here in our practice, it is me, and then I also have another Dr. Priscilla Jackson, who's a naturopathic physician. So we work really close together and treat patients simultaneously. So you might see Dr. Jackson at the beginning, but then you see me for acupuncture, or you'll get an adjustment by me after seeing her. But yeah, so we work really close together. And so, yeah, that's kind of our team here.
I enjoy that. It takes a community, I always say.
Yeah.
It's always better than one.
Right.
Exactly. Exactly.
Okay, so I'm sure some of our audience has this question, because this is something that I'm thinking of, because I haven't had acupuncture yet, which I don't know why it's taken me so long to get it on. I need to try it once and for all. But how is it when you take the needle out of the skin? Is there a lot of blood that comes out? Am I expected to have Band-Aids all over my body afterward?
Good question. Good question. Yeah, so it's painless removal of the acupuncture needles. Majority of patients, I say 99% of patients, say they don't feel the needles being removed.
Okay.
Occasionally, there will be a small drop of blood that does come out as you're removing the acupuncture, depending on the area. And then I always am ready with a cotton ball to stop any bleeding, and it literally takes 1 or 2 seconds and the bleeding stops. So you will not leave with any bleeding. Some side effects of acupuncture, occasionally, it doesn't happen very often, but it can happen, is some bruising in the area. But that's basically it, is a little bit of bruising. There's not really any other side effects of acupuncture.
And is it something like cupping? Like the first time I did cupping, I bruised so badly. And then the times after that, I did not bruise as badly. Would you say that's kind of similar with acupuncture? So the first time you do it, it might be a little bit more likelihood of bruising, or maybe a little bit more blood than in the future if you were to keep doing it?
No, I wouldn't necessarily say that, to be honest. Like, I could probably count the number of patients on my hand that had a bruise. Like, it's really like it's not like very common that it happens, but it can happen. It just might depend on maybe the way I put in the needle that day, or the position that the needle was in, or maybe it just caused like more breaks in the capillaries, caused a little bit more bleeding, it really depends, but it's not really something that's very common.
That's good to know.
Yeah, very good to know. So this kind of goes a little bit off the health and healing topic, but again, it's also something for mental well-being and confidence issues. There's a lot of talk about Botox lately, and I hear often that an alternative remedy to that is acupuncture in the face. Is there anything you'd like to touch upon that? Any experience that you've had with that?
I'm very glad you asked. So I recently just got certified in cosmetic acupuncture.
Ah, okay.
So
Another
yes,
tool under your tool belt.
another tool under my tool belt. Yeah. But yeah, so there are certain protocols for facelifts under like eye bag lifts, neck lifts, getting rid of wrinkles, helping with like scars, like helping like reduce like visibility of scars and all of that with acupuncture.
Wow.
So yeah, it's an excellent tool. You're reducing the risk of the side effects of Botox and
Right.
just like that, putting that chemical in your body. And it's very effective. There's so many, you can see so many side by sides of before acupuncture and after acupuncture, and it just like tightens the skin and it's very, very noticeable.
Wow. Okay, Whitney, you're going to be seeing me in your office here soon.
You are more than welcome, Kate. I'd be happy to have you.
Well, that's incredible. And I've been hearing more and more about it. And I've been hearing, everybody has their own opinion on Botox and, to each their own. But it's nice to know that that's not the only solution, that there's a lot of other solutions, in particular acupuncture for that.
Yeah.
How long does cosmetic acupuncture last on the face as opposed to Botox? I know Botox doesn't last too long.
Yeah, so
months, right?
it lasts for a pretty long time. We generally say, especially after the first one, you give it like 6 months, and then you could come back for another session, but then after that, just kind of like as needed. It's a lot because it's not just like you're not relying on like a chemical to tighten the skin. You're actually helping like the blood flow to the area and stuff like that, which is causing over time physiological changes in the skin and in the body, where it's not just like a chemical that's doing it and then the chemical is gone and then you got to do it again. It's a lot more beneficial. Yeah.
Oh, good. What is the age group of clients, patients that you treat? Could you treat children, or is that out of the scope?
No, you can definitely treat children with acupuncture. I have personally not done that as much, but yeah, we're generally here we see anywhere between like mostly females about 20 to 50. But yeah, generally if you're going to treat a child with acupuncture, like a small infant child, I'd probably go more on the lines of like acupressure and just like putting pressure on those areas. But yeah, just older children, if you just put the needle in and take it out, they don't need the needles to be left in them for long periods of time. Because young kids, their nervous system is a lot more responsive to things. So you don't really need those acupuncture needles to stay in for long periods of time. You could literally just tap the acupuncture needle in and then remove it, because they probably wouldn't sit for a very long time and they'd move a lot. So yeah.
The kids don't always do well with a cat nap.
Yeah, exactly. Yep. So just more of inserting the needle and removing.
Wow. Okay. And so you mentioned also acupressure. So that is without the use of the needles.
Yep.
And that's just use of your fingers and your hands instead to get the blood flowing in that area.
Yeah, it's the same concept. You're just using the same channels, the same meridians, and you're just applying pressure there, and it has a similar effect to acupuncture.
If someone wants to become an acupuncturist like yourself, what are your words of wisdom and advice for them? Is there things that they have to maintain once they achieve their degree in acupuncture over the course of their career?
Yeah. So for me, am able to, because I'm a chiropractic physician, I'm able to get like a certification of acupuncture, and then can go on to be like board certified. Like I can take a test and be board certified in acupuncture. In here in the state of Illinois, and I'm sure it's similar in other areas, a lot of the schools, they offer master's programs and then doctorate programs. So you do your regular schooling, like you would get your bachelor's, and then you go and get your master's degree in acupuncture. And then some schools also offer doctorate degrees in acupuncture. So then you just have to follow the guidelines of the states to maintain those licenses.
I see.
Yeah.
And so, kind of just going back in full circle, acupuncture it's ancient medicine, right? It's
Yeah.
ancient wisdom. It goes back centuries. Am I right?
Yeah. Yep. Very, yeah, it's a very ancient remedy, and that's why nowadays, like, there's a lot of scientific studies that actually prove the effectiveness of acupuncture because
Mhm.
it's been around for such a long time. So there's a lot more studies on it.
Behind it.
Mm.
Yeah.
Mhm.
And I often tell, my clients and folks when something is ancient, that's ancient wisdom. What's
Yeah.
not there to believe in and of itself of that, right?
Yeah.
And like you said, acupuncture really can be so universal for so many things, not only for your physical conditions like pain, but also for your mental well-being, for
Hmm.
anxiety, for depression, also for cosmetics and
Yep.
confidence.
Yep.
So there's really acupuncture can be used for, it sounds like just about anybody
Yeah.
in different stages of their life.
Yeah. Exactly. Yep.
Yeah.
Well, I'm sold. I think this is our sign, Hanan, that it's
Yeah,
about
right.
time we do some
We should try it.
acupuncture.
Mhm.
Yeah, it definitely should.
Well,
Yeah.
thank you so much, Dr. Whitney Dunlap, for sharing all about your expertise on acupuncture, the modality of it, why it can be such a powerful tool in our health and well-being. And again, that's really the purpose of Health
Mhm.
Beats, is just to start the conversation and to open up the doorways of health. Doesn't have to be linear. It doesn't have to look the same for everybody. There's so many ways to feel better. There's so many ways to kind of kickstart your health and well-being. And so this is one of those avenues to try that. So thank you so much for inspiring us and for sharing some of your passion and your knowledge on it.
Yeah, well, thank you for having me, and thank you for shining lights on
Yeah.
the like natural ways to heal, because it's really such a powerful, powerful tool to help people on their healing journey.
Yeah.
Absolutely. And that we have a responsibility, right? That
Mhm.
it's, we are the vessel, or we are kind of the master of our vessel. So we have
Yep.
responsibility to take care of our health. And acupuncture is a way for us to kind of take the lead. Okay, this is what's not feeling right in my body. This is what's not going right in my life. Let me try this and see how it works and make the additional changes, like the lifestyle changes we mentioned earlier. And let's keep going down that path. So again, thank you so much for
Yeah.
igniting that to us
Yeah.
and sharing that. It was very special.
Yeah.
If someone wants to
Thank
find
you.
you, where could they find you at?
Yeah, so my practice is called Natural Healing Space, and we're located in Oak Brook, Illinois. And so you can find more information on our website at mynaturalhealingspace.com, and you can make an appointment right there online for acupuncture or any other modality that you would like. Yeah, and we'd love to help you on your healing journey.
Oh, that's
That
awesome.
sounds
And
good.
just so y'all know, I have been to their space at my natural healing space in Oak Brook, and it is such a beautiful, tranquil spot. You guys did such a phenomenal job. You feel like you're like in an oasis. It is such a calming space. They always have just really calming music, nice scents in the background, some good teas to offer. It's just like a sanctuary, is what I say. You have a very inviting practice. So
Well, thank you very much.
yes. Well, I know Hanan and I will be seeing you all
Yes.
soon.
Very good. We'll save your spot.
Thank you. Pencil us in.
Yeah.
All right. Well, Dr. Whitney Dunlap, thank you so, so much again. We really appreciate your time and again, sharing all your knowledge on acupuncture.
Mhm.
We're so excited to hear all about it.
Yeah.
And so that wraps up our episode here on Health Beats with Hanan and I.
Mhm. Yeah.
Thank you all so much. Until next time.